Hi, and a very good morning to everyone, especially our lecturer. So my name is Norhanis, and alongside with my other group members, which is Sofina Khadija and Mirka Abigail, we will be presenting our topic, which is countertransference, is it unethical? So we derive this issue from the topic of the counselor as a person and as a professional. Let me move on. For today's agenda, we'll go through the introduction of the topic, and then we'll explain the issue of countertransference. Later on, we will explain the conflicts of values associated with countertransference, and lastly, we'll go through the pros and cons of the issue. To answer the question is about countertransference, is it unethical or is it ethical? And the issue itself, it arises from definition of the countertransference because it was defined in two ways. Like there is the classical views and there is totalist view. So in the classical views, Freud, he defined countertransference as a therapist's unconscious reaction to the client's transference, and it was viewed as a contamination of the therapeutic process, which is a negative thing that could impact the therapeutic process. But later on, he defined and viewed countertransference something as something that could also positively impact the therapeutic process. So within this definition, we can see that countertransference could either be could be negative or a positive thing that could happen in a therapeutic process. But in a totalist point of view, they also define countertransference as everything a therapist brings as a human being to the therapeutic process in which both helpful and detrimental ways. So as they define countertransference as something that could positively or negatively impact the therapeutic process, the issue of whether is it unethical or ethical arises because how could you know that the countertransference that you are as a practitioner that you are experiencing is ethical or unethical? So we're going to look through that later on in this presentation. So then the questions of how do we know that we are experiencing countertransference? So Kenneth, he mentioned that countertransference happen when a therapist interacts with the client in ways that resemble relationship patterns in either the therapist's life or the client's life. For example, if you have a client and somehow in the therapeutic process you could relate to the situation of your client, and then you realize that you have personal feelings or personal bias involved in the therapeutic process, that is when you are experiencing countertransference. So the issue of the countertransference, we wanted to know why is it considered unethical or why is it considered ethical? So countertransference is considered unethical when it negatively impacted the therapeutic process. So destructive countertransference can have a significant and pervasive effect on the counseling relationship. It can erode any sense of trust or rapport that may have developed between the counselors and also the clients. So countertransference that happen in counseling session or in psychotherapy could lead to multiple ethical issues that could affect the therapeutic process. This is when it is considered as unethical. So the multiple ethical issues could be like personal boundaries or conflict of interest, self-disclosure, and etc. This is an example of how countertransference could positively affect or impact the therapeutic process. So it is a story of a Korean American child psychologist, her name is Anastasia Kim. She faced a countertransference when she consulted a 16-year-old Chinese American who being pressured with his family expectation influenced by cultural values. This child psychologist experienced countertransference with in the therapeutic process because she relates to the client because both of them are the second generation of Asian American. So the situation of her clients. She relates to it, and initially she has personal biases that could affect the therapeutic process, but then she realized that she is experiencing countertransference, and she consulted with her colleagues and her mentor to resolve her feelings. And later on, she realized that she could understand her client better, and that with um, the empathy that she has, she could better help her client and later on achieve the goal of the therapy. So you guys can read the story and see how the countertransference that the child psychologist experience actually help the client to reach their goal. Another example of case study is from a clinical example where there is a psychotherapist who had conflicts and unresolved feelings when she encountered her client who was an obsessive young man suffering from personality difficulties. So this psychotherapy, during the therapy session, her reaction towards the client's problems and stories were very muted because she had unresolved feelings and conflicts, or even anxieties that were going on during the session because of the client's attitudes and personality. So her client, he suffered from personality difficulties, and he tend to be like very judgeful and being mean towards other people, and that leads to the psychotherapist like having thoughts of like whether or not she's good enough, whether or not people judge her for anything that she did, and that affect the therapy session because she is experiencing countertransference. But when she realized that she is experiencing countertransference, she consulted with her colleagues and her mentor to resolve any anxieties and any conflicts that she had going on. And at the end of the day, she were able to help her client to resolve any conflicts that her clients experienced prior going through the therapy session. And that is all from me today. I'll pass to the next presenter. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum and hi. My name is Sofina Khadija, and I will be talking about the conflicts of values that comes with countertransference. So being a counselor requires one to incorporate and integrate their moral values, good conscience, personal values, professional views, and even cultural values into practice. All these aspects are important because they can help the counselor to thoroughly execute and illustrate positive results for the client themselves. Without these values, it would be difficult for the counselors to be of help to the clients because, as we know, humans are more comfortable to open up to professionals who are able to understand their situations and apply their knowledge in the context of what they're going through. So, however, they must always be, they here means the counselor or social worker, must always be in check of themselves so that they don't, push their views onto the clients. In most times, it may seem difficult to obtain balance. To find a balance is hard because countertransference itself, it threatens to, imbalance. So there are a few ethical issues of interest regarding countertransference, and we've got these points from the NLASW Ethics Committee. So, when concerning countertransference, it is most vital for the counselor to be in constant reminder of the fine line of professional boundaries that fences and encompasses their professional relationship with the client. So this is because countertransference may cause a breach in the professional boundaries, and it creates boundary issues basically, and that can in turn affect the whole session negatively. So the second point of interest is conflicts of interest. So all this talk about boundary issues leads to another aspect, which is this one, conflicts of interest. A question which is noteworthy enough asks, can countertransference result in a conflict of interest that obstructs one's ability to remain unbiased and objective? So this question, it can be met by referring to the ethical guidelines. So according to the Canadian Association of Social Workers guidelines for ethical practice, it is said that social workers must avoid conflicts of interest that interfere with the professional practice and their impartial judgment. So when in these kinds of situations, the counselor or social worker must find conscience that they have to realize that, I have to inform the client if there is any potential conflict of interest that comes up, because that's the most ethical thing to do. So the third ethical issue regarding countertransference is self-disclosure. So should social workers reveal information to clients regarding their shared experiences, for example? The answer to that is yes, it's allowed, but there's always a limit. Again, the social workers or counselors should always refer to the code of ethics in these kinds of situations. Some questions that must be considered are how much self-disclosure might be appropriate, what are the benefits or risks when sharing these experiences, whose needs are being met, is it the counselor or the client, and also how might the social worker and client relationship, the professional relationship, be impacted when these experiences are being shared. Another area of interest is number 4, competence in practice. So once again, the code of ethics proves to be of importance as if one's ability to practice competently is affected, the counselors or social workers need to consult to the code of ethics and maybe other relevant sources and standards. So of course, the social worker, the professional social worker, has the option to terminate the professional relationship and refer the client to another professional when it's in the client's best interest. So the final area of interest for this countertransference phenomenon is consultation or supervision. When experiencing countertransference, it's important for the social worker or counselor to consult with peers, or even better, with a supervisor. Though it may be a little challenging to open up about one's vulnerabilities, it's still important. It's vital because it not only addresses the issues that could impact on the service of delivery in practice, but also consultation helps bring out professional development in the social workers field. So here's an example where the social worker or counselor would need to look for consultation or supervision from others. So let's say I'm a counselor in my mid 30s. I have a husband and maybe a 7-year-old child. So my client, who I'm seeing at the time, like right now, is also a woman, married, and also has a young child. And my client is expressing their troubles at home. So she's expressing and telling her stories, her troubles, and I find myself relating to what she says because I go through them myself at home as well. Soon enough, I find myself experiencing countertransference with my client. After the session ends, I quickly go to my friend, a peer or even better, a supervisor, my senior who's in the same field as I am. So I'll ask for their help, like advice, even though it's kind of embarrassing to say what kind of troubles I am experiencing, which is the same as my client, but I need to express it because it's a big thing, this countertransference. I need to get over it and to find a solution to put up the barriers, again, the professional boundaries. So by asking my supervisor or a third party point of view, basically, I can get a better perspective on the issue and try to overcome it and resolve it. So that's all I have for my part. I will pass on to the next group member, which is Miracle, to talk about the pros and cons. Thank you.
Hi everyone, and welcome especially to Dr. Asang and all my wonderful classmates. I'm Miracle, and I'm going to be continuing on with my team's presentation on countertransference. Now, we've talked about what countertransference is, and also we already gave some examples from case studies to really understand what is countertransference. So now I will be talking about the pros and cons of the issue, which is the pros and cons of countertransference. Now, when we think of the word countertransference, mostly we think of the negative side, right? When we studied about countertransference, when we read about it, we think to ourselves, oh, this is a bad thing that, is one of the negative aspects that can happen to a therapist or to a client in the session. But like everything, there's a yin and a yang. So there's also the negative side and also there's the positive side. What it is, we'll talk about it now. For now, let's start first from the negative countertransference. Now, some of the things that I'm going to be sharing here is just some of the negative countertransference, not all. And I know that some of this may seem already, you might know it already because maybe we've already studied it, but I'm trying to explain it in a way that's very simple, and so all of us can understand it better. So, negative countertransference. Like I said before, countertransference can happen in a session between the therapist and the client. Now, what are some of the things that may result because of countertransference? Right. Number one is from the therapist side is overprotectiveness, which is their overprotectiveness of their client, and this usually reflects the therapist's deep fears. So when a therapist have unresolved conflicts in themselves, if they have any problems that they have from childhood, personal conflicts themselves, within themselves, unresolved, so it's still there, that conflict, it can countertransference by countertransference, it can affect it in a way that it can negatively affect the session because of the the feelings of overprotectiveness, and because it comes from the therapist's unresolved fears or unresolved feelings, the therapist may steer the session or the sharing away from the area that the saying goes, hits close to home. So they might steer the session away from the area to avoid being hurt because, again, overprotectiveness of the clients. And this can also result in the therapist treating the client as children, even though the client may be is already an adult, if in the case of adult clients, or youth or youth clients. And they may even treat not only treat them very fragile, or like for example, like, oh, the client is made of glass, so have to be very careful, very have to think before you speak, so very very fragile. And it can come to the point where the very worst is the therapist may treat the client as a child. So for example, for this, right, think of like a mother who's this is very stereotypical, by the way. I'm not saying that all mothers are like this. Mothers are amazing. I'm just saying, for this example, we might hear stories of mother-in-laws of being very protective toward their son, until to the point where they treat the daughter-in-law very bad, what we watched in dramas and stuff like that. So is the mother-in-law, right? And so that's the kind of like not the skit. That's kind of like the situation that we can see this as in a simple way. So that's one of the negative aspects of countertransference. It's a long name. Number 2 is gentleness, and this comes from the therapist's fear of anger. So the therapists are they become very gentle. The way they treat the clients are very gentle, very gentle. Why? It's because they're scared of anger. So because in therapy, it's us discovering our fears, discovering our issues, and it's not always pretty. That's the reason why we go to therapy, right? So there are moments where what might be discussed in a session might be very the client may be very angry, like, why are you doing this to me? Like, why? Because we're trying to come to a problem solving, right? We're trying to come to a place where the client can, oh, you're right, this is what I'm doing, oh, this is what I should be doing, something like that. But because of the therapist's countertransference of their fearing of the anger to them, like, oh, later the client will be mad at me, later the client will mock me or curse at me. So because of that, they create the session to be very bland, very stagnant, very very well, I want to say like not PG-13, but very very fragile, very up there. It's no like really going deep into the problem, and you're basically avoiding anything that the client may be angry at them. Number 3 is constant reassurance. Because of countertransference, the therapists always need to be constantly reassured that their methods are effective, that they're helping their clients, that their clients are always you're doing good, oh, you're really helping me always. They need to hear this over and over and over all the time. And this is because they need immediate results. This may cause them to need immediate results. If not, they may have anxiety about it and may become discouraged, like, oh, my client is still like this. Why are they not improving? Why are they not? So they may they may have those feelings of discouragedness. Number 3 is this is the most I think it's the most famous one. I think everyone here already knows what it is, which is developing sexual or romantic feelings. Now, countertransference, sexual or romantic feelings. Now, this is one of the most, like I said, everyone knows this, and this is one of the times where the therapist may develop feelings for the client. In another way, it's like maybe if the client because they're in a vulnerable place, right? So the client may may act in a seductive manner, and the therapist may mirror that. They may mirror that. So this is where countertransference have a hand in also, and this is for sure. This will highly interfere with the work, both of the therapist and also the healing process of the client, because they're in a very in a very vulnerable place. So the therapist may be taking advantage of the client because of this. And again, this sexual or developing or starting sexual romantic relationship is one of the things where it's not illegal, but it is unethical. So as for the negative countertransference. Now, I want to take a moment just to talk about countertransference and in suicidal patients. This is from an article, so this could give us more of an example. So according to Ellis et al., it is well known that suicidal parents bring forth strong feelings in therapists, and this is known as countertransference hate. Intense anger, desire to leave suicidal patients, desire to not treat them anymore, and other intricate reactions that come from the projection of the patient. So the patient, the client, have feelings of self-hatredness, and they project them into the therapist. So it comes to the point where the therapists themselves, because of the countertransference, the therapists themselves, they feel stuff. So, and with the presence of those uncomfortable, strong feelings, the therapists feel distress over the feelings of hate, because it's again projected into them, right? And unconsciously use defense mechanisms to ease the discomfort. Now, this is the part where I know also everyone here should know this part also. Number one is repression. So they may be bored during the session. This is a therapist. They may feel bored. They may feel tired. They may feel have difficulty in attention, which is the one thing where therapists really need to have, which is attention, listening to the clients. Number two is feelings of inadequacy. They feel helpless. They feel like they're in a situation where they can't help their clients, and they really want to, but they feel like they cannot. Number three is unrestricted efforts to rescue the patients. So they really put 100 and not more than 110, maybe 150. They really put all their efforts to rescue their patients. Really, really motivated to the point where it's becoming, very toxic and not healthy for the therapist. And projection also. Projections, it's heavy thoughts of dread about the patient's suicide, because we're talking in this case is about suicidal patients, right? So they feel dreads about, is my client going to commit suicide? What's going to happen to my client? Even though there might not be a risk, any suicidal risk factors present at that moment, but they will always feel this dread. Number 1, 2, 3, 4, 5. Number 5, it's denial, which is the devaluing the patient. So they devalue the therapist may devalue their patients until they may feel like pity or anger, or until the point where they feel indifference towards their client, which means I don't really care about you anymore. So that's what might happen because of countertransference. Now, I know I've talked about a lot about countertransference, all the negative aspects, and all the bad things that can happen in the session, both for a therapist and a client. But like I said, pros and cons, right? There's always we should always not look at the negative side, but also at the positive side. So useful countertransference, positive. Useful countertransference is more focused toward the client with the goal to positively help the client. Positive. So we might ask ourselves, can it be useful? Well, apparently it can. Good news, right? So because of countertransference, it may result in the client and the therapist having a deeper and better understanding of one another. Because hey, you're going through that stuff. I went through that stuff too. I went through that stuff too. So they may feel better. Their relationship may become more deeper because they have that better understanding between one another. Let's not forget that about a therapist and a client. Even with friends, right? When we make friends, we randomly think, hey, you like that movie? Dang, I like that movie too. And then you start talking about it, right? Because you both are interested in the same thing, or you went through the same thing, So that's one way that countertransference can help. Another way is developing the trust between the therapist and the client. Because when the client feels, wait a minute, you went through that too. I'm going through that too. So I can trust you because you went through it. I can trust you to help guide me. I can trust you that you won't, spill the beans to any other. I can trust you. And that will really help the healing process, the session. Number 3 is develop more ideas on how the client can relate to their family members or their friends and strengthen their bonds with their friends and family. So when they're going to therapy, because the therapists have gone through the stuff, they may be able to brainstorm on more ideas how to strengthen the bonds and the relationship of the client towards their family. If they're trying to heal from something, if the client is trying to heal for something, they really need support. This is the countertransference can be useful in brainstorming more ideas and how can get them closer to one another. So that's how countertransference can be useful. So I once again thank you so much, everyone, for listening to our presentation. I know it's a long one, but I want to thank you for, hopefully still watching it until now. And hopefully that all of us can learn something from this also. So, and this is the references that we use. So once again, thank you so much, and have a nice day, everyone, and please stay safe.